Before having implant dentistry done, it is critical that you are evaluated with a CT scan. This scan gives us three-dimensional views of all the vital structures in the jaw, tells us right where to place the implants. This is computed topography. Although I practiced early in my career without it, I couldn't practice without it now. It lets us perform procedures in the same day. We could not do that prior. This machine gives me a three-dimensional view of your jaw. I can see the skin, how thick it is. I can see the bone, how dense it is. I can see where are the nerves at, where are the arteries at, where are the structures I need to avoid. It lets me place the implants in the exact location. We can also develop a protocol for putting teeth in the same day because we have very, very precise, accurate measurements. So much different than how we placed these 35 years ago. Unfortunately, not every practice uses a CT scan, and even some don't even believe in them. The ugly truth of this is in the past few years, multiple deaths could have been avoided if the doctor had used a CT scan prior to surgery to evaluate the patient better. This would have eliminated surgical complications that led to infection and the person bleeding to death. One of the major difficulties I see in patients getting started, taking that first step, they don't know what their options are, and they'll never know until they call. But it starts with being diagnosed properly and having those options explained to you. Come in for your free consultation. This will help us determine what path to take for your treatment. It could be simple and only need a very simple examination. We may have to take a CT scan. We may have to take other x-rays and other diagnostic tests. But before we can know all that, we need to meet you. We need to have you come in to determine what's the best route to get your mouth healthy again. Don't wait till it's too late. Don't wait till you have pain or swelling. Many times the body will not give you warning signals. You need to be seen now.